Greetings. Let us talk about the role of a tattoo injection in GI endoscopy. These are my acknowledgements, and today's learning objectives include the following. We will learn about the purpose of a tattoo and also how to put a good tattoo. You need to have a 10 cc's of saline filled syringe, a pre-filled tattoo syringe. These are available that we can buy from our vendors. And then we need an injection catheter. So let us talk about how do we go about putting a nice, beautiful tattoo. A tattoo should be inside the wall of the colon. It should not go out into the peritoneal cavity. How do we make sure that we place a tattoo inside the colon wall? So take a syringe that is pre-filled with saline and flush the injection catheter with saline. That's the first step. Next, detach that saline syringe from that injection catheter and take the tattoo syringe, give it a good shake so that the tattoo comes into solution and not sedimented to the bottom, and then attach that tattoo solution syringe to the injection catheter and then inject until the tattoo solution reaches the biopsy port, and then you stop. That leaves you the remaining portion of the catheter that is going through the scope filled with saline, and that is important. Once the endoscopist makes a puncture and enters into the submucosa, your next step is to inject. Instead of injecting, make sure you tap, tap, tap on the plunger so that a small squirt of saline comes out, and if the needle is in the submucosa, you will see a nice bleb. If you don't see that bleb, the needle is outside the colon wall in the peritoneal cavity. So that's tap, tap is very important. Once we see the bleb, then we can inject more to fill that saline bleb with the tattoo. And as the bleb gets filled, and once the endoscopist is satisfied, then we stop that injection. And by stopping the injection, as the needle is pulled out, it will prevent excessive spilling of the tattoo into the lumen. Otherwise, the whole area gets dirty. How do we place a tattoo and how many tattoos do we need to place depends upon what we are dealing with. If we are dealing with a cancer and the patient needs to go to surgery and we want to help the surgeon find that lesion, then it is important to put at least 3 or 4 tattoos. Distal to the lesion. Distal, I mean towards the anal side of that lesion. And start the first tattoo in the dependent portion. And if in case there is a leakage of tattoo, it will not spill all over the lumen. And then walk your way up to the non-dependent portion. This is the best way to put a tattoo for a patient with cancer. You may have to take your injection catheter out, flush it with another saline syringe, and then go through the same steps so that you get a beautiful tattoo placed. Do not be in a rush and try to poke through the wall of the colon and deposit your tattoo into the peritoneal cavity. It can lead to complications. It may make it harder for the surgeon to figure out exactly, and he may be confused. On the other hand, you're not dealing with cancer, but dealing with a polyp, and you want to come back for resection or want to send that patient for resection to another center, then again you have to mark that site. Unlike cancer, where we put multiple tattoos, for a benign polyp, for future reference, we place one tattoo, 3 centimeters distal to that lesion, that is towards the anal side, on the same plane as the polyp, using the same technique of creating a saline bleb and filling it with the tattoo. And take a photograph so that the lesion and the tattoo are in one picture, so that when we come back, we can really find that polyp easily, especially if the polyp is a subtle one. Although tattoos are very useful in locating the polyps, you should avoid putting a tattoo if the lesion is in the cecum, because cecum is very easy to identify. You should also avoid putting a tattoo for a polyp in the rectum. There is one caveat. If it is a small carcinoid tumor in the rectum, then it is important to put a tattoo to locate that lesion. What are the problems? You should not put a tattoo very close to a lesion that you want another endoscopist to resect, because tattoo can create a lot of fibrosis and makes resection technically challenging. You should also not put a tattoo outside the wall of the colon, because that can create peritonitis. It can create future resections technically challenging, that might even end up requiring surgery. I want to stress this point. As a technician, when we are injecting solution, especially when we are injecting solution, that you want to find that submucosal space to create a bleb. Don't forget this technique of tap tap on the plunger so that a small squirt comes out. It allows the endoscopist to find the submucosal bleb, and once is assured and you're assured, then you can inject a little bit faster. As you inject, do not forget to count loudly. 1 cc injected, 2 cc's injected, 3 cc's injected. That way, the endoscopist knows what is going on and he can confirm the effect of that injection, whether he's creating a nice bleb in front of his eyes or whether he's depositing the whole material into the peritoneal cavity. As a technician, one could do a lot to improve the safety of our patients. Thank you.